Radical innovation starts with medical discussion. Talking about the future and what comes next with Project MedTech.
Hello, everybody. I'm Lindsay Deneen, Director of Marketing and Engagement at Project MedTech, and welcome to another episode of the Project MedTech podcast. If we can help you in any way, or you would like to suggest a future guest, you can email us at info@projectmedtech.com. If conversations like this are helpful, that's exactly why we bring people together at our signature events, the Midwest Showcase, the Startup Symposium, and Coming to America. For more on our events that include networking, education, and pitch competitions for startups, check them out at www.projectmedtech.com. We even have sponsorship options if your company is also dedicated to accelerating medical technology to impact patient lives. So reach out today to get involved. The Project MedTech podcast is proudly sponsored by Ward Law. Ward Law Office, LLC is a boutique law firm specializing in the practice of patent and trademark law. They are committed to providing inventors, entrepreneurs, and businesses of all types with personal and professional services and are flexible to meet your unique needs. It is their goal to both educate on how to secure valuable patent and trademark protection and to provide high-quality services at rates affordable to independent inventors, startups, and small businesses alike.
Today's episode of Project MedTech is brought to you by Wheelhouse DMG, performance marketing for privacy-first industries like medtech and healthcare. Every Wheelhouse client experienced record growth in 2025. That's the result of more than a decade building the data infrastructure, measurement systems, and domain expertise that healthcare and medical device marketing actually requires. Find out how every Wheelhouse client experienced record growth in 2025 at wheelhousedmg.com.
Without further ado, let's dive in.
Okay, Caron, welcome to the podcast.
Thanks for having me.
Absolutely. So let's start with an intro to who you are, what you do, and if you want to lead up to what you're doing with your background, that would be great.
I'm Caron Trumbo. I'm VP of Operations here at the Virginia Biotechnology Association, also known as VirginiaBio, which is a lot easier to stomach. I have kind of a unique background that weaved me a little bit to what I'm currently doing here at VirginiaBio. I grew up in Biotech County in Virginia, loved it so much, knew as a ninth grader when I did my first Punnett Square that I wanted to go into genetics. And as all ninth graders do, that's what I was going to do for the rest of my life. So when I started thinking about colleges, I wanted to go somewhere that had a good genetics program. And at the time, there wasn't actually a genetics program in Virginia. So I ended up going to Texas A&M because I also wanted Big South in football. So it knocked off all my boxes. While there, I thought I would be a genetic counselor, studied genetics, shadowed a genetic counselor, and then came home crying every day for the summer that I spent shadowing and knew that that was actually not the path for me. So like so many college students, I had to kind of pivot really quickly, and I had done a ton of research while I was at A&M, so I continued doing that research. And then when I graduated, I was able to eventually find a job at Randolph-Macon as a genetics lab manager. So I spent almost 5 years working with Drosophila and lots of students at Randolph-Macon and loved it. But then my husband needed to move to California for grad school, so I followed him there and got to live in Palo Alto. And the first job I had when we moved there was managing a co-working space where I really loved the energy of startup founders. They are such a fun group. I loved learning about what they were doing, especially in the belly of the beast that was Palo Alto in 2013, I guess. But I also was selling laboratory supplies for the company I used to use their supplies at UCSF and Stanford. So I really got to meet a lot of different scientists, a lot of different entrepreneurs, fell in love with what they were doing, knew I didn't want to start a company, knew I didn't want to do sales. So when we moved back to Virginia, I had no clue what path to take. And that's when I learned about VirginiaBio. So they were hiring for a communication specialist, which I am not, although I do a lot of communications work for us now. I knew nothing. And Jeff Gallagher, the CEO at the time, really loved the idea of having a super personable scientist that could work on the staff and help communicate scientific research to the general population and legislators. So he hired me to do this position, and it very much changed. I took a lot of my strong suits and changed them around to make a position that is now VP of Operations. I've been here for 10 and a half years now. There is very little about VirginiaBio I can't tell you at this stage. I went from somebody that didn't know what GAB meant, which is the General Assembly building here in Richmond, my first week when I had to deliver Bioscience Caucus invites, to now helping lead our Government Affairs Committee and all of our other advocacy work we do here. So I've learned a lot. I've been really proud of Virginia, and I had a very not straight path to getting to this position.
Yeah, super interesting. Okay, so I want to spend most of the time talking about Virginia Bio. But before we get there, I'm super jazzed about Punnett Squares now. I can't wait for my 5-year-old and 2-year-old to get to ninth grade so we can do those again.
It's really funny when you learn that that's not actually what you're going to do as a genetics major. But, you know, it was fun at the time.
It's fun at the time. I miss them. For those listening in, you know, you mentioned you went to Texas A&M. And so, yes, I'm born and raised in Ohio. So Ohio State football is a big deal in Ohio. In Texas, there's quite a few programs. And I feel like Texas A&M may sometimes get overlooked by the University of
That
Texas.
other school in Texas is what we call
That
it.
other school in Texas. Now, though, for anyone who is international or in the U.S. and not familiar with college football, it's a bucket list item for me. But to go see a game at Kyle Field at Texas A&M is pretty cool, just based on the videos and games I've watched and seen on TV. It's a really cool environment. I think Kyle Field is one of the bigger stadiums in the
We're in the
US.
top 5 now, I think. We did a fairly large renovation
Yeah.
when we joined the SEC, and now I think we hold like 103 to 108, somewhere around there, 1,000. And
It's
amazing.
Yep.
It is like nothing else
Yeah.
here.
Yeah, it's pretty cool. Yeah, it's actually it's in the top 5. You would have LSU's number 5, Kyle Field's number 4, Ohio Stadium, where Ohio State plays, is number 3, where Penn State plays is number 2, and
Michigan,
the
the
school up
Cows.
north that we talk about
Yeah.
is number 1. Anyways, you brought it up, and I had to mention it because
College football
it's
is
such a cool environment.
My young children and I are currently rewatching Any Given Saturday on the SEC documentary so that I can rewatch us lose in 5 overtimes to Auburn and lose to South Carolina. But, you know, last year was great, and we're going to focus on last year and where we're going now.
Yeah, that's right. That's right. Cool. Okay, so tell me about Virginia Bio and the ecosystem at a high level in Virginia. We have had Nikki Hastings on from Seville Biohub in Charlottesville. And so for people who are listening in, if you want to go back and listen to that episode, that was a really good episode about University of Virginia and the things going on in Charlottesville. We don't have, we haven't done a ton of work down there in Charlottesville, but we have had really good connections with Roanoke and Carillion Clinic and Virginia Tech and Blacksburg there, and that really cool ecosystem. And so we're very, very familiar with that ecosystem. We actually just had she's no longer there. We had Eileen on from Carillion Clinic, and now she's at a dental group, and so we're talking to her next week, actually. But lay the land at a high level for the Virginia ecosystem with the understanding that there's a lot of international listeners that are tuning in, and so I think understanding where Virginia is, what it's around, and what the ecosystem look like would be a nice start.
Sure. So VirginiaBio is the state trade association for the industry. So we are made up of about 240 members. Most of those are our small, 1 to 10 person biotech companies that have a great idea, have some IP, and are trying to figure out how to commercialize a product. We also have all the groups that help them here. So all our law firms, our insurance providers, our construction, anything and everything that our companies might need to support them as they grow, we're going to have in our membership base. So we serve as a conduit to do all of that connection. Most of them are looking for money, people, or space, and we're going to help them find one or all three of those things. Virginia as a whole took a little longer to jump on the bandwagon of biotech than our friends up north in Maryland and our friends south in North Carolina. But we have taken our time to develop a way that works great for Virginia. So Virginia doesn't have one great area that's going to put us on the map in the way that Maryland's 270 corridor does or the RTP area in North Carolina does. We have what we define as 5 biohubs here in the state. So you have the Greater Richmond, Petersburg Biohub, you have Northern Virginia, you have Roanoke, you have Charlottesville, and you have Coastal Virginia. And each one of those have their own strong suit and have their own type of leadership that we were able to set up through a Go Virginia grant a couple of years ago. So each hub has a industry partner and an academia partner so that they are able to work together for building that entire ecosystem. And then VirginiaBio kind of serves as the center, and we help connect all of those hubs. To your point, Charlottesville has a really great, they've established biohub. So they actually have their own group, Seville Biohub, because they've had so much going on now for so long that it made sense to have their own one, and they have wonderful leadership with Nikki. In Roanoke, we have another organization called the Roanoke-Blacksburg Tech Council that is housed under the Roanoke-Blacksburg Innovation Alliance that's really pushing things forward. Here in Richmond, we have Activation Capital with the help of ECU. And then in Northern Virginia, we have George Mason and the Manassas Innovation District, which is called Nexus 234. And then Hampton Roads, we have ODU and their economic development partners that are really leading the charge there. So each area has really great leadership that's helping grow it right now. And when you put all 5 of those areas together, we are definitely a strong biotech ecosystem. So we are able to connect all of those all of those biohubs together. So if you live in Roanoke, but you're really interested in pharmaceutical research that you might not have there yet, we're going to put you in contact with somebody in Richmond, Petersburg area and let you guys work together and see if you want to come this way or if you want to help develop workforce pipelines that will get more students here. So we really collaborate in a way that many other areas can't. And then we always tease from an economic standpoint, it's much cheaper to live in one of these areas than it is to go up to Maryland or even Raleigh for the cost of living. So we're kind of special in that way. The work-life balance is a little bit different here.
Very big deal in terms of when you think about, especially for earlier stage innovation, capital needed to achieve milestones. When you talk about hiring folks and leasing space, it's much cheaper to do it, especially in outside of areas like Boston or New York or San Francisco, and so there's a benefit there. When you say ODU, you're talking about Old Dominion University.
Yes, thank you.
Okay.
And they have
Yeah.
actually
Yeah.
merged with Eastern Virginia Medical School as
Oh,
one
got
entity
it.
now. So they have
Okay.
their own, because previously EVMS was a standalone medical school, which is not the most common thing. So now it's all under the Macon and Joan Brock Virginia Health Sciences at Old Dominion University, so that they're all one big entity.
Yeah, very cool. Awesome. Okay. Talk to me. So state groups are obviously focused on, and trade associations, bringing up, kind of rising all tides across the greater ecosystem. When it comes to people, how much of that is, hey, we want to make sure that our innovators have access to the best possible talent in their geography, but also keep them in Virginia. Like it's a tough thing to do, and that's something that I've always been a big proponent of. Is if you make innovators choose, you know they're going to, if you restrict, I guess is my point, if you restrict them on who they can work with, then they may end up leaving. But if you can give them the resources, like, hey, there's capital, there's space to grow, there's you have access to younger talent, but you can get them kind of consulting and other experts to them potentially virtually. Have you found the same thing in that, like, especially in niche areas? Like, is it one of those things where, yes, we want to keep you here, but please work with whatever industry expert you want to work with?
Yes. So, as part of the grant that was able to help establish these biohubs through Go Virginia, we were able to put in a workforce pipeline portion to that. So, we started with the internships. We were able to help match, I think, 100 internships we were able to do over those 2 years, so that we could get students in their either school or home address area connected with industry partners, get them in the door, get them learning those skills, and then, the hope, and it did happen in quite a few cases, was that they would get hired when they graduated, so they'd have an immediate step up. But we also have networking events that are more focused on bringing in that young talent. So, I was on a call yesterday, and Virginia Western Community College, they require their biotech students to attend networking events in their area. That is part of their curriculum now, so that they can make those connections to those industry leaders. And on the other side, we're telling those industry members, like, hey, reach out. This is where your next set of workforce is coming from. So we're really doing, putting it in your face. But again, if a student grew up in Fairfax County, but they're going to Virginia Tech and they're like, hey, I want to be closer to home, then we're able to also set up those connections of, we see that you're working on this biomedical engineering degree at Virginia Tech. Allow us to put you in touch with somebody in Northern Virginia that is also doing something similar to get your foot in the door. Because we don't want them to leave Virginia, to your point. That is our everyday concern. Is we have some of the best schools in the country, and a lot of students come here for school. We want to keep that talent here and not lose it to Boston or Carolina or Maryland.
Yeah, I think it's such a difficult, it's a difficult thing for all state groups,
Yes.
right? Is to figure out, how do you retain that, and then also how do you grow and develop that talent. And I'd be curious on how, Virginia looks at this as well. But the one thing we hear from a lot of universities, accelerators, incubators, different groups like that are kind of fostering innovation and spinning it out, is there's not enough leaders for there's not enough talent to take these opportunities to the next level. I totally disagree with that. I think that in healthcare opportunities, there is a lot of work to be done before you can go get a commercial experienced CEO to take that opportunity to the next step. There's a lot of stuff that has to be done outside of a university or hospital innovation group in between that time. And you can generally find younger talent to do that, wrap them around with, I mean, again, it's for us, I mean, it kind of sounds like an advertisement, but for like a group like Project MedTech around them, to give them that skill set and knowledge of regulatory, finance, quality, commercial, but let them make decisions and get in that habit and build that kind of expertise. And if they do it well, then they'll probably stay in Ohio, in our case, or Virginia, in your case, for their next opportunity. And that's how you build that talent pool that now can take those things and move them through. How does Virginia look at that talent pool, especially for the earlier? I know larger companies, they probably go to UVA and say, "Great, biomedical engineer, I'll take you." But for innovation, that earlier stage, how do you do that?
So I think getting connected with those talent incubators that you're talking, or incubators and your accelerators in each of the biohubs, is a really good way for those students. But I'm also finding that academia is doing a really good job now of letting students know that, like, there is this other side to your research. So what we're working on could be commercialized in some way. And we interview public policy fellows every summer through a program called COES that the Virginia Academy of Science, Engineering, and Medicine puts on. And this year, I think we interviewed 10 students, and at least half of them were interested in commercializing the research that they were doing, and they just needed to know how. So for me, that was the first time. We've been doing this since 2020. That was the first time I had a large cohort of students ask about that. So clearly it's getting out there. The research they're doing can be commercialized in some way at the university they're at. They just need to know who to be put in contact with. So since each of those hubs that we have a university and in most cases an accelerator, I just immediately put them in contact with whoever was in charge of their early startup accelerator in that area. Then they get on a call, they can find out what to do next, and it really helps them have all of that knowledge before they're even graduated. So little hand holding steps like that are really helpful. I do think we have to do a better job training our faculty in academia how to do it so that they can then train their students. It's, it works to do these one-offs of like, yes, you're interested, here's who you should talk to, but if we can train the faculty, then the faculty can do that for a whole group of class or a whole class of students. And that would be really helpful. So I think we're getting that way. I know VCU here now has a business and biotech program, so they're starting to think that way. And little steps like that are going to keep those students here because their connections are all going to be local. They're not going to be getting connected to someone in San Francisco. So in most cases, it's going to be someone probably in Richmond or Northern Virginia or Roanoke or Charlottesville or coastal Virginia. So it really helps tighten that pathway to staying.
Yeah, totally. How do you deal with, so I guess, let me ask you this. What do you think VirginiaBio has done well for the innovation ecosystem? And where is there, hey, this is where we have to improve? I know for, because our Project MedTech's headquarters in Ohio, we generally get a really good look into how the state groups in Ohio are thinking about things and get involved in those conversations. Now, our client base is all over the world, but for Ohio, it was identified a few years ago that, hey, growth stage capital is a place where we might be a little weak, and now there's a group called the Ohio Fund who's kind of solving for that, and some other groups as well. So I'm curious from your side, it's like, yeah, what are you doing well right now? What is on that we're going to solve for this next, and what's on the long-term growth?
So what we're doing well now is collaborating and connecting. So I feel like there's no one in our hubs that you're going to visit that isn't going to connect you to someone immediately just because you say, hey, I'm interested in X. And they're going to know who to connect you with somewhere, wherever they are in the state. We do such a good job of letting everyone know what's happening that there aren't any, well, it isn't as siloed as it once was. So I'm really proud of that growth. It also helps when you're talking to legislators, they're all over the state. So if we can tell them what's happening in Richmond and Charlottesville and Northern Virginia and how they're all connected, you're able to get state funding. Like recently, Richmond, Charlottesville, and Roanoke were able to get state funding through a group called Project Vital through Go Virginia and a couple other resources for $4.9 million. And they're able to help build up their labs in each space. And then we also, we had our state grant. We were able to get that because each of the regions collaborated on this larger grant. So the collaboration is just something, I think it's special how we do it here in Virginia. And it's what really sets us apart, I think, from other states. But as far as the things that we could, opportunities for growth, definitely funding of all types, but especially VC funding. Virginia just isn't really known for our amount of VC funders, and therefore our companies are having to go out of state to get that funding. So we'd love to bring more in-state as well as, show off our companies out of state and all that's happening with the talent here. Then our state entities like Virginia Innovation Partnership Corporation, they're doing a really good job of seeing those needs for funds right now, and they're trying to figure out ways to solve that, whether that be with more state funding or more funding groups through them, or essentially funding an organization like ours to help spread the wealth in some way. They're currently trying to solve that problem because they recognize that that's something that they can help with. And then when you're talking to VCs, it's very helpful if you can say, the state of Virginia just, put in $100 million. So clearly that's where we're going. So, the big growth opportunities for funding, which is everyone will say, but we're on the right way. In the past couple General Assembly sessions, biotech in some way has been written into every budget. So we are finally getting more state funding and as an ecosystem, and that's going to really, I think, change the trajectory of where we go.
Yeah, that's the finance piece and the funding piece is such a big deal, especially that VC angel group funding.
Yes.
It's a difficult thing to solve for. And Virginia is I'm pretty sure, I don't know off the top of my head, but I bet they're in the top 10 in terms of like median household income in the United States. And so really it's like, well, the money's there. There's high earners there. It's just, someone has to go in and kind of talk about the importance of investing. And I think things get this is where this gets important, is that you have to have people who want to invest in these early stage life science opportunities and are okay with that risk, but also aren't tied directly to only investing in the state, because this is how then you get that collision of networks there, right? I mean, anyone who thinks they can do it themselves just aren't going to survive long term. But if you can start to build those angel ecosystems, those VCs that are looking at life science opportunities, but they're bringing other deal flow from other states in, and also investing out of the universities in Virginia, that's where that magic happens. And then people start to see returns from that. The state of Michigan has honestly we've found this pleasantly surprising, just done a phenomenal job of this. They have a number of angel groups up there. They have a number of VCs up there. They invest in Michigan opportunities, but also outside the state. They're getting wins in more areas. And then what happens when these investors have wins in these other areas? Well, then they're ready to invest more capital. And so it's just like such a great network effect. And so it's something that the state groups can't control, right? But support. And so
Yes.
I totally hear
Cheerlead
what you're
for
saying.
it.
It's a big
Completely.
deal. That's right.
Yes.
Yeah.
I mean, that's why
Yeah.
we work so closely with Virginia Innovation Partnership Corporation, because, they have a little bit more pull and the ability to do these things. And they see the need. So we're always happy to work with them. They started a lab to launch program last year, which is fast tracking for licensures out of universities. And it's, I think 6 of our R1 universities are part of it, and making the IP process like 30 to 60 days so that they can fast track these things and then eventually help them find some venture capital and investor engagement once their project is a little more established. Things like that are really going to help Virginia as a whole down the line. We're still in the first year of it, so I'm excited to see what happens with it. But state entities putting that kind of time and energy in projects like that just show how gung-ho everyone is about increasing this.
Yeah, that's awesome. So you mentioned earlier that you got the first kind of like bite at the early stage innovators through managing that co-working space in Palo Alto. Now you get to be around all kinds of innovation at the state level. What are you most excited for in the future for Virginia Bio? And it could be not just with the organization, but just in general with the state. Like, what are some of the areas in life science that Virginia seems to be excelling at?
So, first thing that comes to mind is the Alliance for Building Better Medicine, which is a funded entity that started in 2022, I think so, or at least the money
Okay.
was awarded in 2022. And it's to set up a group to help onshore advanced pharmaceutical ingredients. So Flow is kind of one of the big groups in that. I cannot wait to see what that does for workforce, what that does for drug costs, what that does for, you know, our nation's defense, having so many of these things onshored. But also because of that, they were able to bring, I think it's 16 organizations together as part of the alliance now. And they're building whole workforce pipelines for that industry. So they got a tech hubs designation a couple years ago. They are bringing more businesses to Virginia to be around this. And I can't wait to see what that looks like in 30 years when, you know, we've established all of these companies in Virginia, when we have a workforce for them, when we have something that other states can look at and say, you know, look how Virginia did it. So I'm really excited for that. I also think that there will be talent pipelines coming from all the universities for that, and all of our ecosystems and biohubs will be connected in some way and play some part in that. And that's going to build up all those other ecosystems. So it's not just going to be your pharma, it's going to be your med device, everything, because we're going to get funding in the state. We're going to have all of our support systems for it. So I think it can be something great. And I can't wait to see where it goes.
Yeah, that's super cool. Awesome. So let me, I have a couple questions that I like to close with in some episodes more than others. For this one, let's think about if you are outside the US, you're looking to come to the US for your innovation. We are seeing a lot more of that. Before, folks used to go to Europe first and then to the US, and people in Europe used to commercialize there first and then come to the US. We're still seeing that too. But for anyone who's looking to come to the US, either pre-commercialization in their home country or they have commercialized out there, now they're looking to come to the US, what's the one thing they need to know about the US healthcare system, specifically around innovation here?
So they want to innovate. I think that's one of the things, you know, I can't speak to the national healthcare system. I can speak to some of those in Virginia. I just came from lunch with Virginia Hospital and Healthcare Association. They, most of the large to mid-sized systems are working on the innovation side now, because they see the need for that. And that's one of those great economic growths that we can do to bring companies here. You know, here is your talent. We already have it ready. Here are your industry partners. We already have it ready. And here's your introduction to your healthcare system so that you can make those intros, do your clinical trials, whatever it is you might need.
Yeah, I mean, what, you know, to have a hospital system that is hungry for innovation, but is also willing to trial things, like no matter what, whether you're full scale commercial in Europe or not, or other countries, when you come to the US, it's the same thing. You got to trial it out, see where you're, they're different healthcare systems. So you got to see where you're going to bang your head on the wall. Where's the nuances of selling into these healthcare systems, and to have people who are willing to work with you and partner with you on that is such a big advantage. So
Yes.
that's super cool that you all are doing that. Last question is, if you could recommend a book to read to listeners, what would that book be? And you're already laughing. It doesn't have to be
Oh, it's not.
nonfiction. It could be fiction.
It's
Okay,
not.
perfect.
So,
Yeah.
full disclosure, I survived 2025, and I was hoping I would need to do it in 2026, but here we are, by only reading romance novels, with the exception of Stanley Tucci's books, and he has to read them to you because he's Stanley Tucci. So, given the time that I'm a real type, and there's a whole romance genre based around STEM female leads.
Okay.
And one of them is currently being turned into, I think it's Amazon Prime, movie here in a couple weeks, called The
Okay.
Love Hypothesis by Allie Hazelwood. So that is going to be my book recommendation. It's wonderful. The trailer for the show recently came out, so I also think it's going to be great. But I have read every single Allie Hazelwood book known to man, and that it's great. It's just fun reading.
Awesome. Okay. Yes, I see that book on here. I also see the show that'll get released in September 23rd of
Here we go for
2026.
23rd.
Awesome. Very good. All right, Karan, hang on for 1 minute.
No
We're going to
problem.
chat offline, but thanks so much for doing the podcast today.
Yeah, thank you.
Hi, I'm Freddie Coffey, Director of Marketing at Jumpstart. The Project MedTech podcast is proudly sponsored by Jumpstart Inc. Jumpstart's Trailblazer Accelerator helps Ohio's most innovative early-stage health tech startups fast-track their growth with tailored advising from serial entrepreneurs, non-dilutive funding to fuel their journey, and unrivaled access to a network of experts, resources, and investment opportunities. Whether it's improving patient outcomes, advancing digital health, or reimagining care delivery, Jumpstart provides the high-impact services and critical resources to bring big ideas to life. Learn more at jumpstartinc.org/startups.
Thank you for listening. At our core, we at Project MedTech are networkers, educators, and consultants. We meet you where you are to bring value and to create impact. We care deeply about helping medtech companies succeed right from the start, through to exit, by providing consulting and fractional services, hosting impactful industry events, and of course, sharing incredible guest insights like the ones you heard today through our podcast. Please reach out at any time if we can be of assistance. Check out our website at www.projectmedtech.com or email us at info@projectmedtech.com.